I'm Joel Pearlman from Retina Consultants Medical Group in Sacramento. We're part of the Retina Consultants of America Research Network, and I'm here to discuss the results of the TH103 Phase 1A clinical trial for wet macular degeneration, first in human. TH103 is kind of a remarkable molecule. It's based on a drug that we all use commonly, Aflibercept, and Aflibercept was designed to reduce VEGF levels in the eye. It turns out to have a remarkable ability to reduce fluid and improve vision in patients with wet macular degeneration. This original drug from the mind of Napoleon Ferrar, who's kind of the forefather of these drugs, Napoleon felt that we could make the drug last longer, give a greater durability signal, if we change the molecular structure of Aflibercept so that it bound to materials inside the eye. Specifically, he replaced one of the VEGF receptor domains, domain 3, from VEGF receptor 2 to VEGF receptor 1. It turns out that VEGF receptor 1 has a heparan sulfate glycoprotein binding domain, and that it sticks to extracellular matrix and cell surface of the cells in the eye and has a much longer residence time. So the point of this experiment was to see if A, TH103 behaved as we would expect, like Aflibercept, and B, if it had a longer residence time in the eye and gave a more durable effect. However, this was a Phase 1A trial, and so this is early safety signaling with the idea that it will inform a greater trial, a bigger trial in the future to see greater efficacy of the drug or greater durability of the drug. We weren't really powered to see long durability in the Phase 1A trial. So the results of the Phase 1A were very encouraging. First and foremost, we saw that TH103 behaved like we would expect Aflibercept to behave, and that is in patients who were treated with a single dose with treatment-naive wet AMD, had an average visual improvement of 9.1 lines, very similar to the base drug Aflibercept, and that we saw a concomitant decrease in fluid, a decrease in central subfield thickness of about 118 microns, so behaved very Aflibercept-like. We saw those changes in the first week, and they were persistent for the first month. The Phase 1A was designed as a 6-month trial, and we built in retreatment criteria to see if patients regressed, how often they would need retreatment. And it turned out that on the whole, TH103 had a long duration of effect in the trial. We followed these patients out to 6 months. 41% of patients needed their first retreatment at 4 months, 35% of patients needed their first retreatment at 5 months, and 29% of patients did not require treatment for the 6-month duration of the trial. So durability of effect. When we looked at the PKs, we looked at drug in serum, we saw a dramatic reduction of the detectability of the drug in the blood, consistent with a hypothesis that the drug is maintaining its residence in the eye. If we can recapitulate these results in Phase 2 and Phase 3 trials, we may have a long duration drug to help reduce the treatment burden on patients, reduce the need for patients to see us on a rapid recurring basis. One of the goals in the retina community is to try to develop longer duration drugs, and one of the great advances we're seeing at the ASRS is that some of these ideas, gene therapy, long duration drugs, PDS, are decreasing the treatment burden on patients, and this would be a very simple way to do that. Obviously, we want to be sure that the drug was safe and efficacious. In the Phase 1A trial, we saw some early mild intraocular inflammation, but that was easily treatable with topical therapy. We were not too concerned about safety signals.